Welcome to Mental Health News Radio, the original podcast of the Mental Health News Radio Network. I'm your host, Kristen Walker. I have been hosting this show for over 15 years, and over time, it's evolved from traditional interviews into something I like a lot better, real, free-flowing conversations. On this network and on my own shows, we have multiple hosts and voices across mental health, trauma, and addiction recovery, each bringing their own lived experience and expertise. Some of our most listened to conversations right now center around neurodivergence, including my own late diagnosis of autism and ADHD, along with many other topics that shape how we understand mental health today. I'm also a writer and mental health advocate, which I talk about here and across the network. I'm really glad you're here. Let's get into the conversations. Hey everyone, Kristen Walker here. I am here with someone who's on a really awesome show with me that we're guest hosts on called Holmes Cinema Clues. We'll talk about that at some point. But for now, please everyone welcome Dave Glick to Mental Health News Radio. Hi, Dave.
Hi, Chris. Thank you so much for having me.
Absolutely. Now, just so that, because I framed you well and you were like, I don't know about that, but I said you were articulate enough to say who you are and what
all
you
lies.
do.
It's all lies.
So tell everyone, what is it that you do for your career?
I'm a licensed clinical social worker and educational specialist. And I own a clinic called Triad, Psych, which I've had the pleasure and honor and headache of owning since 2003, which is based here in Metro Atlanta. We have 4 locations. We have Atlanta, Carrollton, Marietta, and Appworth, Georgia, plus virtual. We see people worldwide virtually.
Wow.
And I have a lot of diverse specialties because I have a very short attention span. And I also have two master's degrees that enable me to understand lots of different things. And also, if I'm interested in something, I have to know everything there is to know about it as a form of my neurodiversity. So then once I know everything about it, I then want to work in that space. So I've been doing a lot of expert witness work and expert consultation work as well. So my primary fields I work in are expert witness, consultation and testimony, psychotherapy. I have a general practice and we have specialization in neurodiversity and autism work as well. Plus police psychology. I've been a police clinician. I started in 1994.
Wow.
And I was an embedded clinician at the Drug Enforcement Administration for 20 years. And I'm a subject matter expert now at HIDTA, which most people don't know, but that's high intensity drug trafficking area, which is an Office of National Drug Control Policy. So I've trained more police in the field of personality disorders than anyone else in the country that we're aware of. No one's keeping track, but based on what we can find in our research, I've probably trained more police in personality disorders than anyone in the world. So it's another feather in my cap I'm very proud of. So of course, I also specialize in treatment of personality disorders as well. And what else do I do? You name it, I do it.
And you're a guest host on Holmes.
I'm a guest host on Holmes Cinema Clues.
Right.
Which was a lot of fun. It was a lot of fun for me because for a very long time, because of my mentor, a woman named Cheryl Glick Hughes was here in Atlanta, that she said films can really film and media can convey very strong messages. So we use film, cinema, movie, TV examples to get points across and to teach and help my patients. So then when Stephanie brought up, we're going to look at neurodiversity in cinema, I was all over it because we know it conveys such a powerful message.
Yeah.
Something people can really relate to well.
Well, it gives you something tangible. I literally just orated an essay for Holmes Cinema Clues. And listeners, just if you look up Holmes, Holmes, like Sherlock Holmes, Cinema Clues, there's a Substack and a podcast. And there are rotating guests, hosts that comes on, and we write an article about a movie or a character in a movie or something that we can extrapolate the data and come to a cohesive argument around how this is a neurodivergent lens that we can look through these things. So autism, ADHD.
I've been using media, and a lot of therapists are using media and film. It started with a book. I don't know when it was written. It's quite old now, called Real Psychiatry, REEL Psychiatry.
Ooh, I'm going to write that down.
Yeah. And then Gregory Lester, who's trained more people in personality disorders than anyone in the world. I've trained more police. He's trained more people. He was always using examples from film and television and the such too, as well. So it's really just a powerful medium. And I think and this is a bit of a problem, is that the mental health field has neglected to focus on certain aspects of our population. So you have people who are part of that population getting their therapy from movies and TV. We as therapists have to be providing this. And just recently, there was an article in the New York Times about that very subject. And the author, I've got to get the article and we can put it up here in the recording when we do our editing. But there was a very minor part in a film the journalist saw. And he said, why aren't we doing full films about just this person? And it was about a working class person as well. I just recently took on a position with PESI, which is Professional Education Seminars, Inc. Took me 20 years to break in with them. It was not an easy process, but 20 years, I guess they finally decided to open the door to me. And we did a half-day training on school and workplace violence prevention. But more important for this, that we're going to be doing a full-day training in November, integrating social class and psychotherapy. And one of the big tenets of the training is that too many people who come from working class backgrounds, the only therapy they can often get is from media and TV. Okay, that many times a lot of films we watch, which we think are about one thing, are really about something entirely different.
Absolutely.
So one of the first things I remember really looking at this was I had to teach a class on emotional intelligence to cops. And whenever you're training police, you get ready. It's not going to be easy. If you can't grab their attention very fast, you're done. And so I looked at the curriculum, which was written more for therapists, I think, and not police. And it just so happened what was playing on TV was the film Jaws. And I realized that Jaws really had nothing to do with a shark. Jaws was a film about psychology, completely about psychology, with each of the three main characters portraying either an id, an ego, or a superego. And that's where I fed into the training there, and using the film examples is something they could relate to and did a lot of help. So many, like, for example, I know I'm dating myself. A lot of younger people will never have heard about a film from 1977 called Rocky, with an actor named Sylvester Stallone. Now, it was not about boxing at all. It was about social class and self-esteem and a struggle for self-esteem. Very much so. So again, I think we have to keep deciphering, as was Richard Jewell. And we did Richard Jewell with Holmes Cinema Clues, and doing something with, I'm glad you reminded me, I have to do something on Saturday. I don't remember what it is. So I better do my research and watch my movies, which is a lot of fun, by the way. I don't mind.
Oh yeah, it's so fun. It's so fun to sit and see them and be like, okay, I'm just here to get data. Like I've seen it, I processed the emotions around it. I've seen where it narrates parts of my life. I see what I did here. And now I'm just getting the data. I love that.
Even though I'd seen the film Richard Jewell a lot, even the night before I did, I had to watch it again, take a lot more notes. What did I miss? And what did I miss? And got that done. So that was done. So what was my point? I've lost my point. I had a really good point.
Very neurodivergent thing.
I know it is. I go all over the squirrel.
And this
I forgot what I was saying.
Like making noises. Damn it.
Yes,
Sorry.
I'm a neurodivergent individual. And
when were you diagnosed, and what were you diagnosed with, and when? Like, when did you, because I learned about ADHD well before the autism. So what was your thing?
I was diagnosed with ADD before they called it that.
Really?
I had a really nice label called minimal brain dysfunction. So I have minimal brain dysfunction.
How nice.
My mother was
from dysfunction to disorder.
I have minimal brain dysfunction, everybody. So essentially, my mother was a psychologist in northern New Jersey. And a lot of the great minds in the field of special education, learning disabilities, came out of New York City and northern New Jersey. So there was a New Jersey psychologist named Howard Gardner who wrote The Thinking, Feeling, and Doing You. So my mother was one of his proteges. So I was put in front of him, another man named Joel Warshofsky, a lot of the really big names. And I was, I guess, the sandbox.
How exciting. This exciting.
It really was. And then I turned it into, I went and turned it into a profession. I spent so much time.
A lot, Dave. It really does.
It really does explain a lot about my neuroses and me, for sure.
See, mine was all through horrible trauma and then going into therapy to deal with the trauma. That's where I got all my.
Yeah. I spent so much time in the special ed classroom, I couldn't get out. I made it my life. I'm still in it. But so anyway, the main label I was given was learning disability.
Okay.
That was what's known in New Jersey. New Jersey had something called a child study team and something called perceptually impaired, which means I struggle to process information. If you were to look at me now, the primary diagnosis would be a nonverbal learning disability, which has now just been put under, for the most part, the high functioning autism piece. But couldn't learn math. My social skills were horrible. Impulsivity. So the ADD, my minimal brain dysfunction. Back then we treated it with something called Tofferno. I don't think it's around anymore. But I think the only child specialist I didn't see in northern New Jersey was Judy Bloom, who was an author of children's books.
Yeah. I read all her books. Yes, I know who she is.
We all did. It'd be my honor. It'd be my distinct honor to meet her at some point. But so I'm a Judy Bloom kid. Star Trek, of course, consumed a tremendous amount of Star Trek.
God, yes.
And because I lived outside New York City, we could go into Manhattan for conventions and the such and that sort of thing.
So you got to sort of, you were in an environment growing up where psychology was celebrated and
very much so.
A deep dive. Oh God, that's so
very
awesome.
much so. And I didn't realize how much it impacted me until quite recently. And I think I'm 57. I think I just recently got it in my head that not everyone grew up the way I did.
Right.
Came out of this New York City Jewish intelligentsia because my mother got her PhD at Columbia. So that was part of it too. And it was a certain way of thinking that permeated in the 70s and into the 80s as well. But in a lot of ways, it was wonderful. I'm not something I regret. But yeah, certainly psychology and mental health was very embraced. I'm Jewish. And so in the Jewish community, of course, seeing shrinks is what we do.
I think I could be considered Jewish because my great-great-grandmother was Jewish, and it has to be on the woman's side, right? Because they don't care what the men are doing.
Correct. All that stuff. So
interesting.
Yeah,
well,
but I don't remember what we're talking about, but what was the question?
Another neurodivergent spiral. Hey, this is what we do. This is
I
how
took my meds today.
Yeah, I'm not on any meds anymore. That's interesting. But this fascinates me. This is what I love doing a show because I'll just keep listening and then I'm like, there's the gold. So this thing about you growing up in this environment. Now, I grew up in it just because of circumstance, but also my mom chose to put me in therapy.
Where did you grow up? Where did you grow up?
I'm Southern California.
Well, that was the mindset, I think, was identical. The only thing, you had the influence of Hollywood.
Exactly, which was not a good.
But the mindset was pretty much identical.
Yeah. Yeah, because I'm 56, so I'm the same age group. Yeah. We have all the same references. But yeah, I mean,
most kids from Southern California that were upper middle class or above them and grew up in therapy.
Yeah, and I was not. My mom was a single parent, but we lived like we were middle class because my mom bought a house with a woman that at that time that was not done. And it was as much as it is today. But we could kind of, and I went to private school, like Montessori school and things like that. However, we didn't have any money, but the living expenses were so low because of a shared household that it made it seem like I'd always get teased about being a little rich girl. And I'm like, are you joking?
People didn't understand.
This is why I worked full time at 14? I don't think so.
People said the same thing about me, but it was that my mother really knew how to stretch a dollar, which was very good with money.
And New York, too, is such a rich culture. It's much richer in terms of the things I like in terms of culture. But Southern California, same thing. I went from Southern California to Oklahoma, and I thought I stepped onto Mars. It was so completely different. So for you, with the social part, obviously you're social now, you do these things, you're giving speeches, you're doing all this. So at what point in your life, what I'm trying to get to is, okay, you had all this psychology background, so you had a brain that could already go into a deeper layer of things. Then you find out about these different diagnoses for yourself and the way that they change over time, the way language changes the definition of things over time. And so you kind of evolved with this. When did you get to a place, or did you get to a place where you went, oh, okay, I've worked through the social stuff? Was that before diagnosis or after?
I didn't work through the social stuff until graduate school.
Okay.
That at all. I just didn't. And it caused me a lot of problems and a lot of setbacks, very painful setbacks that I couldn't really understand, to be honest. But thank goodness, the graduate programs I was in, you as a person were fair game. It wasn't just about getting high test scores or completing the projects on time. That the way you handle yourself was a big part of the program. And especially when I entered the social work graduate program, you could be, at the time, you could be expelled from the program with or without cause. If they felt you just were handling yourself the wrong way, that was grounds for status review as well. So as scary as that was, it was the best thing that ever happened to me because people were saying, look, you're going to be more aware of empathy and how other people are feeling and how you say things and couch things, the way you do things. I don't think it's that way anymore with the graduate schools. I don't know. But it was the best thing ever. And so it wasn't until I was in my 20s, I had to really get some very harsh feedback, but necessary feedback about that. And I learned to better modulate based on the environment.
I can see where you hear that. It had to have been destabilizing for a bit.
Or it hurt. It was very destabilizing. Yeah. Pardon my language, it hurt like hell. But thank goodness it happened. I'm extremely grateful it happened as well. It's the little professor. Here comes the little professor.
That's what I heard too. The teacher, I heard that all the time. Yeah. Yeah. And wise for your age, right?
Yeah.
Wise beyond your years. Yeah.
Wise beyond my years, but also horribly immature in some respects too.
Yeah. We have uneven development.
It was a very asynchronous, uneven process, to say the least.
So the autism piece for you, with all of what's going on right now, I see the data from having this podcast network, and I see all of the requests coming in from PR and media and different places, and they're all about the number one topic globally right now in mental health is late diagnosis. So what do you think of all of this that's going on around late diagnosis, especially of women?
Well, I think I'm not going to blame anybody. But I think it's a horrible thing, and it's a big issue in my practice, in my work, that a lot of people had a condition, they didn't know what it was. They're picking up information along the way, often from media. And I know that for myself, I would pull quotes from movies to handle social situations, and I really probably shouldn't have. But I didn't know.
Yeah.
I had this issue, this condition.
Plus, we're kind of good mimics.
Yes, we're very good mimics. We're very good. So it's, for me, clinically, if I can figure it out and make things better for the person, I've done good work. And I do it quite a bit. What can be tricky is if I have a patient, usually a male, who is clearly neurodiverse. And if the male is successful, but they're still having some problems that brought them to therapy, oftentimes saying, look, I think you have this condition. They often don't come back. They feel it's a form of confrontation.
Right.
Psychotherapy, just to make it clear, because a lot of people don't use the term anymore, it means you're bringing up something that makes the patient feel uncomfortable. So it's a significant discomforting feeling, and they've made it very far. It's usually men, but exposing that, making it official, can be a very hard acceptance for them. The women seem more relieved. And are willing to work with that quite well. So much more relieved. But if the man's struggling and they haven't made it professionally, they'll be more relieved, and they'll usually start picking it up and doing well. But it's more dealing with very successful professional men who clearly have this. Usually other people have made the suggestions to them, usually in a joking way. But to bring it up seriously, it can be a form of confrontation and cause a reaction.
I thought it was interesting too. I have a friend who he got his PhD in systems and engineering at 17. He was a full tenured professor by the time he was in his 20s. Flies planes, opens multiple companies, does a lot of the programming and everything on early AI systems a decade and a half ago. But people have brought up to him over and over again, dude, you're definitely on the spectrum. Oh, no. I'm not like those people. And I wondered, because his sister is too, and I wondered, What that's interesting about that, and I've had this discussion with him and I've talked about it publicly and he's fine with it. Otherwise, I wouldn't say it. But what I found interesting was the sister was not allowed to, she had to follow these kind of norms. And he, being male in their family structure, he was fully supported in every way because of his giant brain and all the things that he did. So for him, he doesn't, quote unquote, need to say, I'm autistic. He's got all the support he needs. But his sister, on the other hand, is in a whole other thing. And their family structure is structured that way. But I thought, what a great example in front of my face. I know both of these people of what it is to be nurtured in that wiring and what it is to be ignored within the same family.
Right. And for a long time, Jody Carlton brought this up, was that for a long time, the thing was, if the person has a college degree, they can't be autistic.
Right.
I couldn't make this up if I tried.
Yeah.
But the information put out there on how things were done now looks pretty ridiculous as well. But that was very common, or if someone was brilliant, it was just attributed to their brilliance. That after growing up in New Jersey, I moved to Boston. And then I moved across what we call across the river to the Cambridge side. And it was so clear to me that in going around Cambridge, Somerville, Medford, Massachusetts, that probably half the population was neurodiverse, especially when you got to Central Square in Cambridge, which is MIT territory. But
yeah,
we're all brilliant. Everything's fine. I fit in wonderfully, by the way. I was very happy living there.
I bet you were.
Go to get a beer.
You're like, wow, I'm normal here. Damn.
Right. You're having this very brainy conversation, that sort of thing. So it's great. And when my first job in special education was not in a classroom. I started very atypically, which is an interesting word to use, but I started out at the Disability Services Office at Boston University. Yeah. We were all we were talking about at the time was learning disabilities, LD. But these students would come in like, okay, well, we gave you the accommodations or the interventions or the services you need for your LD, but they were still struggling. We weren't really sure what else is going on here. My boss said, well, they struggle with social relationships, but we didn't have a better framework or label like we have now. And sometimes we just didn't know what to do. They gave me a lot of those cases because I can be very forceful and quite bossy and kind of encouraging. Well, this is what we're going to do. And it worked well. So that was the focus. And now we just know so much more. Right. And with the women who mask better and present differently, now they're coming out and we're noticing their behaviors as well and what's happening.
Oh, got me. Hi, masker. I've had people say to me, I had an attorney when my mom was going through a divorce, the attorney said something about, well, I wouldn't say you're weird, but you're definitely eccentric. And this is before my diagnosis. And I thought, oh no, I'm leaking. My mask is not, I didn't know it was called a mask then, but I'm not holding it together because my weirdness is coming out my ear. And so I quick buttoned it up and now I'm, here's my weirdness, enjoy it. But it's such a liberating moment when we finally, especially for women that we've been masking our whole lives. And then you just, it flows along with the whole menopause, perimenopause. Women just start being, I'm not going to do this anymore. I'm not going to do that. So it kind of fits on that journey really well, in my opinion, anyway.
I can see that happening. I definitely see that. That's a double entendre, what you just said, that we're dealing with women hitting a certain age. Well, okay, I'm not going to care about this or that anymore. And I'm going to let it all come out, not hide it. And then dealing with that too, in terms of psychotherapy framework and marital framework in a lot of different ways.
Absolutely.
So, for me and for you, because we're pretty much the same age, is one of that, when we were younger, we were told to mask it, or we were taught to pound, or the role of the education people was to pound the neurodiversity the hell out of us.
Yes.
That was a bit of my mission, that I did not want to be known as learning disabled David or perceptually impaired David or whatever the different, or minimal brain dysfunction.
Right.
So I aspired to mask it and make it go away. And most people, it's interesting. One of my staff recently said to me, look, I never would have known you had it if you didn't tell me. But people who spend enough time with me start to figure it out. They see my compulsions. They see me talking to myself. They see if I'm interested in something, I have to know everything about it. And it comes up. But what my point is, though, that it went from being something to be ashamed of to something you can wear proudly as a badge of honor if you choose
Yes.
as well. So for me, it's such a different mind shift. Now, it's much better for the field and for our patrons, especially in the autism space. I mean, in one of them, I teach an autism, I do several autism classes, but there's one I call Autism Through the Years. And I do a big section, a big part of the slide deck is dedicated to pop culture. Now, clinicians say, why is pop culture a part of what's supposed to be a CEU event? And I say to them, if you don't think pop culture affects how you practice, what your patients are going through, you're out of your mind.
And it makes this course that offers CEUs much more interesting.
It makes it much more interesting, but what we're seeing is with the pop culture embrace of neurodiversity.
Absolutely.
It makes the therapy much easier. And the big issue was there was a lot of anger, some of it justified on the part of parents, especially its kids. They were shunned. They were socially isolated in their communities. People didn't understand why their kids were doing what they were doing. People would constantly call protective services for something they didn't understand. So what we're seeing, and like I said, because I've been around in the space now for over 30 years, is that it's made our work much better and much easier because of all the acceptance out there. I think a good example, I don't think we can use it on Stephanie's show because it's not hidden. It's not a clue, was an ABC show called Speechless. Now it has Minnie Driver in it, the actress Minnie Driver.
I remember that show. Yeah.
Very, very fond of. And actually, her son
too.
was autistic. He had other disabilities in a wheelchair. But what it showed perfectly is what these families go through. And it was the most accurate description of what a family with a child with severe special needs has to cope with on a variety of levels. I think it made it for 3 or 4 seasons, which was pretty good.
Yeah, that was a good show. I love her.
Also, What's Eating Gilbert Grape?
Yes. Oh my God.
I used to teach at a police academy here in Georgia, and I would teach the class on developmental disabilities and autism. And I'd show What's Eating Gilbert Grape, because that film also did a very good job of showing the role of the police. As a police officer, what is your role? When you get called to the house, there's a special needs kid who may be getting violent or there's a safety situation, what do you do? And you see that in What's Eating Gilbert Grape, just out of frustration, the cop, I don't know if he arrests Gilbert, but he puts him in the back of the car and takes him away. So Johnny Depp was in it, Leonardo DiCaprio was in it, Mary Stanley. It was if you really want to get a sociologist.
Such a good movie. Winona Ryder.
What was also interesting about that was it showed, here's this special needs kid in a very working class community in the heartland. What do you do? How do we handle this? What does the family go through? But I think we have much better acceptance now. And it's just made things much, much better.
It's made it so much easier. I've been in mental health forever as well, just as a patient, and then working in the field, choosing to work in the field. So watching how things have changed. One of the things that I noticed from that higher kind of, well, not higher level, I don't want to make it hierarchical, but just from a wider view, that because I have access to so much data, was seeing how when narcissistic abuse became the big topic du jour, that's the
like you said, it's the topic du jour. Which,
well, it is starting to wane because we're bringing in trauma language and autism and all these other things that explain a wider lens.
That brings up an important point for me, which I'm sure the internet's going to react lovely to it, but oh well, I'm ready for the back.
Whatever, do it on my show.
Hey, 57.
Who cares? I'm in menopause. I don't care.
Well, another name for menopause in police work is known as KMA time. So it's called KMA, which means you put in enough years to a department, you vested your pension. And if you stay on, you're on KMA time.
Okay.
You know what KMA means?
No.
Kiss my ass.
Oh, so anyway, I love it. I'm writing that down too. That's like ID10T when I was in technology. Yes.
What does that mean? ID10T?
I'd say that sounds like an ID10T issue. And if you spell that out, it spells idiot.
Oh, that's up there. Oh yeah, I have it. It's in file 13, which is a garbage can. But so I get very concerned about trends. Trends worry me. And I was trained in large part by a philosopher who was not an academic. He was a philosopher in the public service, which is a very different thing than
Yeah.
an academic. And he taught me that don't hop on trends, that study a trend very carefully before you
Right.
hop on it, and then decide if it's valid or not. And there have been some trends that have been wonderful. I think the best trend I've seen in mental health that we needed so badly is the concept of gaslighting. I think it's
Yes.
very real. And I don't think it's going anywhere, because the thought that there's someone who can convince you of a different reality is a very significant thing. And then the whole concept of Darbo as well, and dealing with personality disorder or high conflict personalities as well. But I get concerned with a lot. But I think that my concern is that if it becomes a trend and it's thrown around too lightly, people aren't going to take it as serious as they should.
True.
Narcissistic abuse is very real.
Yes.
It's got a direct tie to something called sadism or
Yeah.
sadistic personality disorder, which you're not going to, for the younger people watching today, you're not going to find that in the DSM-8 or whatever version we're on. It was pulled from DSM-3, and it was one of the worst things that ever happened. And again, for the younger generation, always remember the DSM is the most political book on the planet.
Yes.
Okay. I was teaching a class to cops last year, my advanced psychology class, and now I have more clinicians in those classes because police are hiring more clinicians.
Good.
And the student in the class said, well, the DSM this, the DSM that. I finally looked at her and said, I got news for you. This class isn't taught according to the DSM. It's taught according to me. And I'm telling you, I disagree with the DSM. I think the DSM is wrong. And that's how we're doing it. And she was in shock. I don't think because of her age, I'm not faulting her. She didn't think as an independent clinician, you had the right to do that.
Yeah.
if
Foreign
you're-
territory for her to have agency for her own thought. And
Yeah, I can go against the DSM if I so choose to.
absolutely.
And I'll defend it. You can complain, come out and do whatever you want, but I still have the right to do it. It's my prerogative.
So is that what you're worried about, is saying something bad about the DSM? Is that what the thing you were like,
I
look
already
at it?
have so many people. Everyone knows it's a very political book,
Absolutely.
and it's very late to the party.
Yes.
That, for example, they still haven't made the concept of psychopathy or being a psychopath a formal diagnosis. It's grouped in with the antisocial personality disorder. And they're really two very different things. So
Yes.
that's called, I'm going to get in trouble. In mental health, we used to call that cleavage. Okay, so we call it cleavage, okay? I said cleavage, okay? I'm ready for the backlash.
I'm buttoning up my shirt. Yeah.
Yeah, me too. My cleavage is pretty wide.
Men can have cleavage too. Yes.
I have cleavage. I got cleavage. I've got cleavage.
It happens as we age. Yes.
It really does. It really does. Maybe Seinfeld was right. We need the man's ear. Remember the man's ear?
Yes.
Yeah.
I saw, okay, pivot, squirrel. I
Squirrel.
watched a TikTok of I'm newly enjoying sports because I was married to someone forever and sports was a rage event, right? So anytime, and he was into every sport. So I have stayed away from anything to do with sports and the enjoyment of it until now. Now I'm really enjoying sports. And this guy comes running out. I don't remember if it was soccer, whatever it was, but he had a sports bra on. He ripped his shirt off and he didn't necessarily need a bra. And I thought, wow, that we are just going places with that kind of athletic wear being.
No, you have to, your clothing to me is a tool, and the clothes I'm wearing affects how I perform sometimes.
Right.
And I guess also saw my work with police, and I'm also a very avid hiker, at least I used to be. That's called gear, and your gear makes a difference. So social stigma aside, if you've got a piece of gear that works for you, stick with it.
Mm,
I mean, no one makes fun of hockey players for wearing garter belts because they have to keep their equipment on.
right. Right.
So,
It's so
circling back is that examine friends very closely before you hop on it. And they can do a tremendous amount of damage. I caught a colleague, instead of saying narcissism or narcissistic personality disorder, she was, well, the guy is very narky. And I begged her, I said, please don't use that term because I know what it's going to lead to. And she's a huge thought leader in the field. So she's not going to listen to me. She doesn't have to. She's more powerful than I am in my head. But that's not something I care to use either, to really look at what's going on. And it leads to under pathologizing people. And I tell my clinicians, my younger clinicians, you're going to get in trouble if you fail to properly pathologize a patient. You don't properly diagnose a patient, you may be setting yourself up for a very serious fall.
That is so interesting because most of the people, I did 8 years of shows about narcissism because I was trying to figure out a couple of relationships I'd had that were horrifying, as those relationships can be, right? And you figure out as you go through the process, a lot of people, not everybody, but you go, oh, okay, this is just the first person that was horrible enough at this moment in time in my life that I've discovered that this has been going on my whole life,
Oh,
right?
yeah.
Because
Well,
then you go,
become
oh, it
used
wasn't
to
just
it.
that person.
If you become used to it, it becomes normalized. Greg Lester said the biggest professional mistake he ever made was he gave a seminar on narcissism in Beverly Hills. He said it was the dumbest thing he ever did in his life, and he'll never do it again. I think he got chased out of there. And you're from Southern California, I'm talking about.
I do. I dated a very, very famous actor's son. And so I was at a lot of parties, a lot of events and things like that, and family gatherings and what have you, and saw the whole machine from the inside out.
I practiced in California for 12 years. That while I was living in Georgia, my mother decided to move to Carmel, California. And she had a practice called Psychology by the Sea. And there was a rule that you could practice in California at the time for up to 30 days without a California license. So I would go out there, I'd do some intense days and work on some cases. A lot of Beverly Hills and Hollywood kids that come up to Carmel to hide. The family had another house up there while the lawsuit was being worked on or whatever. And listening to their stories and the narcissism they grew up with in Hollywood, which was so normalized. I enjoyed giving them a very genuine experience. And look, there's no narcissism here. We're just two human beings, which for a lot of people can be a very odd concept. For sure.
Explain that more, because people are going to hear that and go, what do you mean there's no narcissism here?
Well, I think there's narcissistic gratification, which we all have a right to, as long as it stays in check. But there's true gratification, there's life with meaning. That being hedonistic, it feels good, but you can only do it for so long. It's a very shallow experience. But when you spend time with another human being, or a genuine encounter with another human being where you learn, and there's deep meaning, it's not something you're ever going to give up. It's really the better of the two, and it leads itself to wisdom and better decisions and more fulfilling lives. But a rabbi once said to me, we send our kids to college. Yes, we want them to be able to support themselves and find work and that kind of thing. But that's only 51%. The other 49% is we want them to have a meaningful life, to understand why we go to a museum, why we read certain books. There's a reason to understand certain things and experience certain things, so we can have a more enriching experience. You can only buy so many Ferraris and Jaguars.
Right.
Put up with it. And it also, then you also look for much more enriching. You look more for experiences than for stuff, I think also.
When I got into podcasting, for me, that was when narcissism language was at its apex, but that wasn't it. It just was at its apex for me. But I am watching it kind of not go away, obviously, but it's being also viewed like how autism was. We didn't know what it was. We pathologized people. We said, oh, those parents don't discipline their kids enough. Look at their kids jumping on a couch, whatever the thing was. Well, then the same thing with narcissism. A lot of people are understanding trauma can explain a lot of what we're seeing here. There is a difference. I could never get people to understand, and I'm not a clinician, so I didn't try that hard, but to understand that there is such a difference between garden variety narcissistic distortion and a full-blown personality disorder.
Right. Well, the way you distinguish it is the narcissistic behavior occurring across all environments? Can this person modulate, put different aspects of their personality forward? That there's times to be narcissistic, but a family funeral is not one of them.
Right.
And for me, the way I treat most of the person, I'm going to get, the internet, the backlash is going to be so bad. Because I don't really promote my work with personality pathology, but I'm about to start getting out there more, is that with most of certainly the B cluster personality disorders, I pull from police work, and my approach is not loving and understanding.
Right.
And if you go to these conferences, especially on borderline, on all the personality disorders, no one has any one cohesive way of doing things. It's A lot of, and even the big guns in the field don't even get along and they can't agree. But Robert Hare, he doesn't make grandiose claims. Robert
Right.
Hare,
He's very,
he's the one looking at psychopathy, and he's quite humble. What I've read of his writings is he admits, I think the reason I like Hare so much is he admits his limitations. He doesn't admit his limitations. He admits the limitations of his work. To me, that is a true intellectual. A true intellectual will tell you the truth. And the greatest thing that ever happened to me was being taken under the wing of some amazing intellectuals, which is a term people are even afraid to use the term intellectual. I'm not. And then to meet these intellectuals, and I'll give a plug. He's my mentor. He is deceased. His name is Edwin J. Delatra. Ed Delatra invented the field of police ethics. He invented the field. Him taking me under his wing. Another man, a big wig in the learning disabilities world, was Loring Brinkerhoff, who just recently retired, I heard, but he was a true intellectual. And you had to state, well, this is what we've got. Here's what's right with it. Here's what's wrong with it. Here are the limitations. So for some reason, the discussion has lost that. Not everything it's all one way, or this will work with everything.
right.
In my treatment of the B cluster personality disorders, I prefer to see them in my Marietta location. Even if they're going to go virtual, they have to come to Marietta a couple of times because I put all of my cop kitsch on the wall. You see the hats from all the different police departments, the challenge coins, the patches. And it happened I had a case with a woman that was borderline who made it clear to me that if therapists get her mad, she'll act out violently, destroy property in the office, and walk out.
Oh, yeah.
Now, I've been doing I was embedded with the DEA, and it was a very different DEA at the time. I was doing some very intense work, and I'd just gotten back from the road where I was deployed, and I was not in the mood for her nonsense when she made this threat. And I've been doing a lot of work. If you're going to be a police clinician, you have to understand that therapy ethics and police ethics may clash. You have to make a choice. But I was not in the mood, and I just said to her, when I'm not here talking to you, I point with them. I point to all the hats and everything. I said, you get violent here, I will jump on you so hard. You will not know what hit you. I will bury your face in that carpet. You will taste it. You'll be placed under arrest, and I may break your arm in the process. Don't act out here. Don't act out here. And I said, you think you're crazy? I'm crazier. So let's see what you got. She was shocked. She fell over. No one's ever said that to me before. She was unhinged. She was unnerved. She was shook. But she came back next week. And she kept coming back. And she eventually said to me, no one has helped me more than you. No one ever stood toe to toe with me. And we know with borderline, every 12 visits, they get better. And I said, we had a contract. Keep making it to 12 visits. I said, at some point, I'm going to disappoint you. And then after I stood up to her, she put me up on a pedestal, not a surprise. And then she sexualized me, not a surprise at all. But I said, we're not budging. We're getting the work done. But you've got to make it to 12 visits, 12 visits, 12 visits. And yeah, I worked with her for quite a long time. She said to me, no one's ever helped me more. Thank you. So, but the field isn't always willing to embrace that or say that. I guess that's one reason I haven't really promoted my personality disorder work, because I know a lot of colleagues are going to be disapproving. But so I do what needs to be done.
I'm not in as steeped as you are, obviously, but I from a wider view of just general talk out there in terms of what I see passing through of who wants to be interviewed, it is a lot of people talking about getting diagnosed with autism, and then especially men, especially men getting diagnosed later in life, and that the thing that they have gone to therapy for, that they have been divorced over, is that they were diagnosed as having narcissistic personality disorder. And then they find out later. Now, you can have both, obviously, autism and NPD, but a lot of them with behavior change and an awakening and a wider field of reference about mental health in general and other people and behaviors, they realize they were not that. And now they're working in the lane of autism and they're doing well. And of course, there's some people that are using that as an excuse to continue hurting people.
One of the most dangerous things was the thought that people who were autistic couldn't have personality disorders.
Right.
It actually caused a lot of deaths. It caused a lot of, in my workplace violence training, prevention training with PESI, I dedicate a lot of slides to that. A lot of slides to that.
And in working, I know we're going to close on this one because this is so important and we could do a whole other show on it. But when you're working with police and you're looking at someone and they're doing a profile on someone to see if they have psychopathic markers, I'm probably saying it wrong. I apologize ahead of time. But when you're in there, you are also looking for other behaviors that could mean something that aren't, like in the case of
Absolutely.
Richard Jewell, as an example. So you become an advocate for the other side of things.
I think one of the biggest regrets of my life is I'll never get to meet Richard Jewell. I would do, and he died at a young age, he had diabetes. I need to research. There were several attorneys. The film only showed one, but it was Lynn Wood and whatever their person's name was. Lynn Wood's still in Atlanta. When I have some downtime, I'd love to find the man lunch and just talk to him. But as I said in the podcast with Stephanie, you can make the case that the film Richard Jewell was just a remake of Beauty and the Beast. He looked like a beast, he talked like a beast, when in reality he was a prince.
Yeah.
And this man came from very humble upbringing and had the world against him. I have no question he was neurodivergent. Zero. No, he was neurodivergent at all. You see, in 96, I just finished grad school. But let's say nowadays, let's look at the time it happened, that chances are I would have been brought in, or someone like me, a clinician would have been brought in. If the clinician's skilled, I'd say, look, I think this guy has autism, he's neurodivergent. We need to back off and look at this differently.
Yeah.
What may be happening. And of course, we know that the perpetrator was Eric Rudolph. And Eric Rudolph we're talking about a psychopath. I could talk all about Eric Rudolph as well. That the man joined the army and got into special forces just so he could learn to be an effective terrorist. That's it. That was his whole point of making it into the special forces as well. So,
well, I think it's amazing that you are coming out with, and you have been obviously advocating, but just doing Cinema Clues and all of the things that you do. I don't know all of the things that you do, but the breadth of knowledge that you have in this field, it's for me, because I was a receiver of mental health services at the age of 11. I started. So you can imagine that's early enough in childhood to where how you examine your mind.
I got you beat by 10 years, but go ahead.
Oh, you started at age, what, 1?
My mother. It was
your mother. That's
mom.
right.
Look, her diploma and her thesis hangs in my waiting room.
Yeah. You got it right out of the womb. Exactly.
I miss my mom. Your mom, if you're in heaven, I miss you so much, Mom. I miss you so much.
Okay, now you're going to make me cry. Okay. Well, thank you for coming on the show. I hope that you'll...
I loved Chris. I loved every second of it.
Yay.
Thank you so much for giving me a platform and letting me rant.
Absolutely. Rant? Are you kidding? This was a wonderful...
You allowed me to get my narcissistic supply for the day. Now I have to change and not exhibit my narcissism in all environments.
And remember,
if you saw how my day was unfolding, I wasn't feeling very narcissistic at all. I was feeling the opposite.
And it's like, it's okay to, I mean, I have some friends now that they've been through horrible trauma. And some of their behavior is at that, because they're reparenting themselves, depending on where the trauma started. And for this person, it was very, very early, or for several people, very, very early. And so I've watched like the reparenting themselves, and they do go through a wobble of narcissism, a little bit more grandiose, because that's what you would have done when you were 5 and you couldn't because you were being traumatized so badly.
Application, we've got to be going on 15 years, and he clearly had NPD. And as we know, Atlanta's now another Hollywood. He's a Hollywood person in Atlanta. And sure enough, early on, he wanted to put me in my place, but instead I put him in his place. And now he's the healthiest person, most wonderful person, empathetic, just, it can be fixed.
Yeah.
But he said to me, it's because you stood toe to toe to me when I tried to put you down. And I said, I got put down. And yeah, we'll probably be working together till we're the same age. So one of us kicks, but we're just fine. It's absolutely fine.
Well, that's what's needed in order to carry this forward and to give people grace. And I know there's a lot of people that, especially me, with people that have watched my past shows, me saying something grace when it comes to NBPD. But I do say that because I see it so much more differently now. I'm not erasing the wounding that has taken place for me because of it, but I understand the lens and the landscape from a much wider field of view now than I did before. And I think that is what's important for people. It's the same reason why autism now is so known, because we expanded our cultural and individual views on what this is instead of just
How do we
shame,
how
shame,
how do
shame.
we go from this autism being something to be hidden, ashamed of, horrible, to the wealthiest man in the world going on Saturday Night Live and saying, "I'm autistic. Hi."
Yeah,
That's quite a sea change from Rain Man. I'm sorry.
it is. It
It's quite a
is
sea change.
quite a sea change. And that's what we need to see. Not that I know there's a lot of people that have a problem with that kind of representation, but the reality is it's a spectrum. It's out there. We don't need to be ashamed of it. And examining it and studying it, understanding how it affects your life is obviously what you do for a living. So please tell everyone.
I love every second of it.
Yeah, I can tell. I can tell that you do. Tell everybody where your website, where they can find you,
Oh.
all the deets.
My clinic is called Triad Psych, which is TRIAD PSYCH. There's no E at the end. People like to put an E at the end. There's no E. It's Triad Psych. And the website's triadpsych.org. We have a YouTube channel. We have a Facebook page, which is ruling my life right now, for better or for worse. Please like and subscribe and all the other good stuff. We have a whole team of clinicians who I train in my approach. I would call the Triad approach. So if not me, you'll get one of my proteges. And it's a great team of people, and we provide very good work, actually at a very good price too. So we take insurance for people in Georgia. If you're out of state, we do not. And for certain services, we do not. But look, we're ultimately here to get you better. That what Triad means is the shape indicates control. So we take situations that are out of control, we impose a context on it. So think progress can happen and change can be made is what we aim to do. And yeah, I love every second of it, even though I complain a lot.
I know, and every time you say something, I'm telling myself, don't spin off on that, because I could spin off on a whole other direction that would keep us here for another.
I want to do this again. This is a lot of
Oh,
fun.
we totally will. And I want you to come here. Listeners, if you haven't heard about it yet, we've got a new show called Lawn Chairs in Space. I know it's weird, but
I haven't heard of that one yet. Lawn chairs.
Yeah, we just
What's that
started
about?
it. We're having it here on my property and on Zoom, and it's just all about neurodivergence and our spiral conversations. And there'll be many of us, and then suddenly someone will go off somewhere. And
Well, remember, I spend half the month in Charlotte, so you're only 2 hours away.
perfect.
So I'm not going to invite myself, but if I'm invited, I will not say no.
You're invited
sit there
whenever.
with
We'll
lunch.
figure all that out.
Okay. I'll bring the food.
Good. All right. Stay on. We're going to talk for a minute after.
Okay, you got it.
Thank you so much for
Thank
joining
you.
us.
It was a
we will-
blast.
yeah, it was
Loved
super
every
fun.
second of it.
And, and we will get you on the next show. Thanks for tuning in.
Love it. Thank you. My honor.
Find Mental Health News Radio on all major podcast platforms. To explore our full lineup of shows and hosts, visit mhnrnetwork.com or just Google Mental Health News Radio. We're all over the place. And be sure to check out our newest show, Lawn Chairs in Space, a different kind of conversation where we explore liminal, freeform discussions with voices in the neurodivergent community. You can also find us on YouTube, Insta, and TikTok at MHNR Network and Mental Health News Radio. Thanks for listening, and we will catch you next time.